Diana, this question is for you. One government we're assisting in their social protection response to COVID-19 is the Bahamas. Can you please tell us a little bit about what we're doing? And I know we're very early on in the implementation, but any major lessons learned so far that may be applicable to other participants here?
Thank you, Tim. Indeed, social protection is of a huge importance nowadays. This pandemic has hit almost each and every country in the world, and many governments have initiated social assistance programs for the crisis-affected population, or expanded the existing programs with the scope of COVID-19 response. One of such examples was the government of the Bahamas. On the basis of the existing social programs, particularly disaster assistance program, they have decided to target beneficiaries affected by this pandemic. They have contacted us with this idea in mid of March, and in the first weeks of April, we managed to launch the beneficiary online registration form. The form is collecting applications from those who have lost their job during this crisis. And after a rapid assessment, the system is providing assistance in the form of food vouchers. This has addressed the urgent need of the government of the Bahamas. However, during the further discussions, we have elaborated the idea to provide fully contactless solution in order to avoid beneficiaries collecting vouchers from social centers. A web portal for beneficiaries is being designed right now, where each beneficiary will be able, first of all, to register, and then to apply to any social program, not necessarily those related to COVID-19. Then beneficiary will be able to track the progress of the application, and once it is approved, collect the food voucher directly from the web portal without being required to visit the social center. I think this is a very important approach, especially considering the social distancing requirements that we currently have. Each voucher will be equipped with a QR code. It can be scanned at the certain food stores registered in the system and utilized either in its full value or partially. The system will offer online validation of food vouchers, including all the necessary authentication and security layers. I'm pretty sure that this approach can be used in many countries, not only for food programs, but basically for any social assistance provided during the pandemic and also beyond. This is an excellent example when the automated system responds to the rapid needs of the government by providing digital solution for the existing processes, which in majority of cases are normally done manually and take much longer time. Well, basically this is it in short, and I really hope that this experience can be also adapted in many other countries across the world. Tim?
Thanks, Diana. David, we're also supporting the government of Armenia's response to COVID-19. Similar to what Diana just did, can you tell us a little bit about the history, how we first got involved in the government of Armenia's COVID-19 response efforts, what we've done so far, what's coming next, and any lessons learned so far along the way?
So Synergy has been in discussions with the government of Armenia for already some time, before the pandemic actually started, for design and implementation of the coordination database that was actually discussed during your previous question to me, as well as a database for national development, tracking the public investment, the results, monitoring and evaluation of the results. But that was like discussion in progress. When the COVID-19 began, there was an urgent need to respond to a specific, let's say, challenge. And Synergy came up with the initiative of designing and putting in place a COVID-19 response tracker, so-called database system that focuses specifically on the needs and the supply of, let's say, different development partners, as well as from the government side, on let's say different masks and whatever, or hospitals and whatever, in one single database system. So that was like the first, very first step that helped actually the government of Armenia to consolidate the needs, and then the process of providing assistance to the regions, to the different facilities. I would like to mention that that was done in about 2 week time, my colleague Johannes, who's actually managing this implementation, will speak more to that. And I would also like to highlight the role of the UN, who has been coordinating this effort on the side of the development partners, that contributed actually a lot to the success of this initiative, as well as the government of Armenia, who really took the ownership and made this happen, because without such a leadership and such a champion in place, this type of systems are more difficult to actually survive or even go live.
Great. Thanks, David. Thank you, David and Diana, for that great high-level introduction to our technological tools, the background, and how they are developed and applied to COVID-19 response so far. Now I would like to turn the floor over to Diana to focus specifically on, just making you the host, Diana, here we go. All right, now I would like to turn the floor over to Diana to focus specifically on Synergy's piece of social protection technology, Synergy SPIS, and how it can be used to deliver COVID-19 relief to those in need, and show specifically what this technology that we've been talking about kind of at a high level actually looks like. So Diana, the floor is yours.
Thank you very much. You see my screen, right? Yeah. Okay, so this is a very short overview about the social protection information system that Synergy makes. So what is SPIS? Social Protection Information System, or SPIS in short, is the online platform that allows to effectively target beneficiaries, assess them towards eligibility criteria, and distribute rapid assistance to the disaster or crisis-affected population. Who can use SPIS? Governments, NGOs, INGOs that provide social or humanitarian assistance to the vulnerable households. What are the target groups? Households affected by disasters, needing financial, humanitarian, or housing assistance. Households affected by economic crisis, needing financial or food assistance. Individuals suffering from disabilities or chronic diseases. Single parents, school-age children needing financial support for education or uniform, and any other group of beneficiaries. These are the core modules of the SPIS platform. Well, it all starts by the beneficiary registration. It can be either online or through the service providers, or it can also be done by social workers in the offline mode through the tablet applications. So once the application is collected, it will undergo the targeting and eligibility scoring assessment. Proximing test is only one of the eligibility criteria. There can be many other eligibility criteria integrated depending on the particular government policy. All approved applications will go to the social transfer payment module. This module will allow to generate payment list every periodic time. So it can be 1 month or certain any other period of time. And then the payment list can be distributed either to the bank or to any other payment service provider. The system will have the powerful monitoring and reporting tools, which will be crucial for decision-making and high-level management needs. Another module which will be there in all our SPIS is the case management or grievance redress module. It allows to capture and collect all the grievances, cases, and complaints filed and received from the beneficiaries, and then to process them inside the system by giving the resolution to the beneficiary's request. Well, and finally, there will be a system administration module, which will allow system administrators to modify and change the system settings, including the program settings. Now let's talk a little bit more about the key features about the SPIS. So it all starts by the registration of household information, living conditions, members of the household. Then the assessment of the household conditions, either in online, by online validations, or through the home visits is conducted. So as I said, proximity test is just one of the eligibility criteria. And then the system has alerts for social workers to display any alert type of notifications in case if application processing is delayed. This tool will help social workers to go in line with the schedules and policies of the social service providers and the ministries in general. And of course, there will be a periodic payroll generation and integration with financial units and payment service providers, as I said. Now let's see a couple of screenshots. So this is a common household form. It has the identification screen and the enrollment. It has information about caregiver and any other information related to the household. As you can see, there is a QR code there. So each household will have the household card and the QR code will be printed on it. So basically, this QR code will be used by a social worker to scan it from the mobile application and easily and quickly identify the household in the database. This is personal profile form, which is used for every household member. It contains personal information and some information about education and health of the particular member of the household. This is a workspace or a common design of the workspace. This workspace is used for processing the households and applications in the SPIS system. So the next key feature functionality is the grievance redress or case management module. It is used for collecting complaints and grievances from the beneficiaries or other citizens interested in social assistance, right? So this is a form, like a sample form of the grievance. It contains information about the complainant and the identification about the case itself. It also has information about the processing of the case and the resolution. And each case is going to finish by a satisfaction of the beneficiary. Flexibility in generating payroll and integration with external payment service providers. As I have already mentioned, the system produces various types of payment documents depending on the needs of particular government and the ministry. This document can be exported in a PDF format, or it can be even integrated via API directly to a payment service provider. The payroll module also offers a reconciliation, which allows to track whether the payment has reached the beneficiary or not. Reporting and analysis. This is a key feature for decision makers, higher management, and those who are in charge for the progress of the social program. There are various tools to create a wide scale of reports and to build dashboards and then save them in the system so that the higher management can just access it by one click. So I strongly assume that these tools are very much useful for decision making and for management of the social programs. On top of the reporting module, we also offer monitoring and evaluation M&E module, which allows to build the M&E framework, including key performance indicators, objectives, and targets for each social assistance related indicator, and then to make a comparative analysis and to track the progress of the overall social program. Mobile application for offline data collection is just an add-on, which is basically used by social workers in the fields where the internet connectivity is not good or is just missing. Now let's see how the SPIS can work and help for COVID-19 needs. It all starts with targeting and of affected beneficiaries. So SPIS will offer a platform for rapid targeting of all affected, disaster-affected or COVID-19 affected beneficiaries. This can be done by via social service providers or through the beneficiary online registration form. Next, the system will provide the assessment of the beneficiary against eligibility criteria, against proximity test score, against validation with any third-party databases. This all depends on the policy of the particular government and the social service ministry. And finally, the system will provide rapid social assistance distribution functionality. So it can be customized to do it through the cash transfers or through the food vouchers or by distributing the in-kind assistance. So this is one of the sample portals that we have created for social assistance. This portal contains information about the programs as well as the applications for beneficiary registration. And once the beneficiary has been registered, they will have their own space in the portal. And food vouchers or coupons, as it is mentioned here, will directly appear in their personal space on the website. So basically no need to walk into the service center location or meet anyone related to collection of these coupons or food vouchers. So they can directly collect it from here, either from phone or from just print it on the printer. This is a sample of food coupon. As you can see, it has the QR code. So basically this food coupon can be presented either in a printed form, in hard copy, or it can be presented on the screen of the mobile phone to the food vendor. And food vendor will scan it up, and then the beneficiary will be able to utilize it either in full value or partially and get the food assistance from the food vendor. So basically, coming back to these points, SPIS is the excellent response to the COVID-19 situation, especially to the governments that are launching social protection programs. Thank you.
Thanks so much, Diana.